Hello, ladies and gentlemen, wherever you are. It's a pleasure to meet you all here. My name is Dinda Ramadhina from Department of Environmental Health and my friend Vallery Violila from Department of Public Health. We are from Faculty of Public Health, University of Indonesia. We welcome to all of you and it is a great experience for us to be in here, this ITTP COVID-19 conference. Here, we would like to present our paper titled Vaccination Problems in Indonesia from January to June 2021. A pandemic has struck every country in different parts of the world, including in Indonesia. One of the steps taken by the government is to establish the development of a COVID-19 vaccine and vaccination. The COVID-19 vaccination aims to create herd immunity. COVID-19 vaccination in Indonesia began on January 13, 2021. However, as the vaccination process in Indonesia progressed, several problems emerged, including differences in public belief and understanding about vaccine. It affected the vaccination programs in Indonesia. According to the data from sehatnegriku.kemenkes.go.id, Indonesia's target of vaccination is 181.5 million with two vaccination batches nationally. However, the target has not been achieved in several target groups, especially for health worker groups, public workers, and also elderly group. This article will describe some data about some problems and possible solution to them. For the research method, the method used in this paper is literature study and also analysis process. For the literature study, it is to describe the type of vaccine used in Indonesia, and analysis process is to analyze problems that occur during vaccination programs implemented in Indonesia. The main data used is online news article from Indonesia electronic media related to vaccination constraints in Indonesia from November 2020 to June 2021.
The vaccination process in Indonesia is technically described in the regulation of Minister of Health number 10 2021. Broadly, this regulation explains about the vaccination process, including the planning and the implementation of vaccinations that should be done in Indonesia. For vaccine planning, we started by phasing out priority groups of vaccine recipients due to the availability of vaccines and the number of risk groups. The next steps is the determinations of health facilities implementing vaccinations that having operational permits. The third one is the registration and verification of vaccine recipients with the help of local leaders. The fourth is calculation of vaccine needs and complements equipped with the distribution plan to ensure the needs are available on time according to the schedule. These four processes were run along with the preparation for dissemination, advocacy, training of health workers, monitoring and evaluation plans, funding and operational planning for remote areas to ensure that COVID-19 vaccinations reach all targets. For the vaccine implementation, there are some principles that need to be complied. The vaccination is performed by health workers who have competences, doesn't interfere other health services, health screening need to be done prior to the vaccination process, apply health protocols such as physical distancing and sanitary process, and ensure the integration of COVID-19 surveillance activities. The principles were manifested in the flow of COVID-19 vaccination services described in the regulation of Minister of Health number 10 2021. There are several vaccine rejection related theory that we found. The first is related to hoax information. Invalid health information circulating on online platforms about the substances, effectiveness, and side effect of vaccine, in addition with low levels of literacy and risk perception in public, interfere people's acceptance of vaccine. The second one is about the vaccine selection problems. The various types of vaccine candidates and invalid information toward particular vaccines interfere people's acceptance of certain vaccines. The third one is related to the vaccine distribution problems. Limitations number of vaccinators and cold chain facilities to be distributed all along the country reduce the total number of vaccinations. And the last one is the post-vaccination problems. Viral reactions of adverse event following immunization make people reluctant to be injected.
For the information that we use to know the most common problems, we use a table. This table consists of the title of the article and its sources, the date of publication of the article, and the indicator of the problem. I will explain more about the problem indicator and the result after this following slide. The problems were grouped into 7 categories. Number 1 is information system and vaccination registration problem. Number 2 is vaccine distribution and supply issue. Number 3 is distrust of COVID-19. Number 4 is vaccine effectiveness issues. Number 5 is information about content and basic ingredients of the vaccine issues. Number 6 is vaccine effects in the body issues. And the last one is hoax information. The highest percentage of problems are number 2, number 6, and number 7.
In conclusion, although planning and implementation plans have been arranged, it doesn't mean vaccination is free from obstacles and hindrances. Vaccines have not been fully accepted by society for various reasons. It takes role and cooperation among various levels of society from various fields. In an effort to maximize the ongoing vaccination program, there are several things that can be improved for the government, the community, and academics. For the government, there should be more socialization and education by disseminating valid information regarding to the availability and distribution process of vaccine COVID-19. The government needs to perform the right calculation based on the data of each region needed. For the public should succeed the government program by complying with all vaccination procedures and improving knowledge related to vaccinations. For the academics must educate the public about vaccination by conducting studies and research and providing advice to government stakeholders in the policy making process. So here's the references that we used, and these slides mark the end of our presentations. We hope that our writing could contribute to solving issues and we all could succeed the vaccination process and end this pandemic together. Thank you.